Hey guys, my name is Dan. I'm a veterinarian and welcome to the video. Today we're talking about collapsing trachea. Collapsing trachea or tracheal collapse is a condition that's most commonly found in small dogs. The way I want you to think about it, guys, is the trachea is the windpipe and it has some U-shaped cartilage with a band of fibrous tissue above it. Now, when the doggy is breathing really hard, that turbulence can make the trachea compress a little bit. Or if they're working really hard, or if they start to cough for some reason, that can lead the trachea to bend and compress. And the more it bends and compresses, it has the potential to maybe touch itself on the opposite side of the trachea, or it just weakens the cartilage because it's already a little bit weaker because we're a small dog. Now, when we start seeing collapsing trachea, it kind of builds on itself. So when the trachea bends and the dog gets irritation from it, they cough and they cough more and they cough more. And it's kind of just like cascading thing that it starts off small and then it becomes like all the time. Collapsing trachea, guys, can happen in the trachea right here. It can also happen deeper in the chest too, in the bronchioles, which doesn't make sense sometimes because the trachea is up here, but anything in the upper airway that's compressing can be considered collapsing trachea. Collapsing trachea, guys, is a real challenge, and you should definitely think of it as a chronic management. It's something we're going to be managing chronically with having really good days or really good weeks or months or years, but it could come back at any time. It's not just an easy fix like an infected skin issue or an eye issue that goes like an ulcer. It's something you must manage long term. Now, the way you want to think about it is we want to control a couple things. One, we want the dog to stop coughing and stop it from just escalating this problem. Most veterinarians will prescribe some sort of cough suppressant. And the cough suppressant is given multiple times a day for an extended period of time to relax the trachea by having the dog stop coughing. That's number one, and probably one of the most important things you will do. Now, if the dog has been coughing a lot and we have a lot of inflammation, a veterinarian may also prescribe either an NSAID or a steroid to reduce inflammation in the upper airways. Reducing inflammation in the upper airways can be very effective at reducing irritation and the need to cough or the itchiness that's experienced by the doggy. Also, if the veterinarian feels like the collapsing trachea has led to a compromised upper airway and they're worried about an infection, an antibiotic may be prescribed as a secondary thing because they're worried about a secondary infection from the poor anatomy of the collapsing trachea. These meds together can be really beneficial, also making sure the doggy is taking it easy, not getting worked up, just laying low for a couple weeks as we heal up. And when symptoms come back, meds may need to be restarted. The one thing we talk about at the end of all this would be surgery. Surgery is not commonly done. It's a wire mesh in most cases that goes down the upper airways to open them up. This can lead to repeat infections, chronic inflammation, and the mesh can be irritating to the doggy. Surgery is, again, not commonly done, but consulting your veterinarian or even a specialist can give you a good idea if it's something you want to consider. In most cases, guys, collapsing trachea is a medical management with medicines. It's usually not a surgical thing. Keep that in mind. As always, guys, my name is Dan. I'm a veterinarian. Thanks so much for watching. I really appreciate it. Please feel free to share comments below of things that you'd like me to cover or questions you may have. Remember, I can't give advice regarding your doggy on YouTube, but I'm more than happy to share just common knowledge and veterinary knowledge about certain topics.